guys, welcome to the fourth session of postural correction physical therapy tips. I'm Dr. Azar, Doctor of Physical Therapy. Today I want to talk about the actual cervical spine a little bit. We covered a lot about posture before, and we also covered some tips about the corrective exercises for the posture, but what we're missing is the actual vertebral column that you need to be a little familiar with. So the vertebral column of cervical spine is composed of seven vertebrae, which is the little bones that they are on top of each other's, as you can see, with the lordosis and concavity, which we already talked about, and they are helping the controlling the weight of the head. So what can happen is during some kind of trauma or accident, the ligaments that are supporting these guys here, which I'm gonna show you the ligaments there. These ligaments, okay, they are non-contractile tissues right here, the ligaments, and they are holding the vertebra against each other and don't let them move and basically stabilize that vertebra. So if the ligaments get injured during that accident or trauma, that we call it whiplash, so you can get some kind of instability on the vertebral column that can eventually cause pressure to that little cartilages here. Because as you can see, if these vertebrae move against each other because this ligament is loose, then what's gonna happen is this cartilage can get worn and torn because of the malalignment of the bones that can happen, that we call it subluxation, because of that ligament injury or ligament became too stretched out. What happens when you get whiplash, your ligament gets stretched out and then sometimes it gets tear in the ligament. Hopefully it is not a tear, it's just overstretch of a ligament. Physical therapists can help you stabilize the neck with the help of other contractile tissues, which are muscles. So your non-contractile tissue, the ropes, are loose. The ropes right here, they are loose because of what happened during the whiplash injury, but we're gonna help you to protect you with the muscles around the actually neck. So what can happen, the muscles can actually take over part of the job of the ligaments that's missing because the ligament became non-functional and overstretched. So these muscles, as I showed you before, right here, these muscles are not too effective because of they get too tight when they feel that it's very unstable, the area is very unstable because the ligaments, the ropes are torn and the little bone are moved, so these become really tight. And by being tight, they don't really help. Sometimes we think if we tighten up the muscles, they can protect the little vertebra, but not all the muscles. I wanna have you understand the difference between the muscles that are deep and the muscles that are superficial. The muscles that are superficial in the neck, they need to be loosened up because if they tight, they act like a puller and they actually pull the bones even more out of place. They try to help by getting spastic after a whiplash, but they actually don't help and they harm even more by getting tight. They try to protect, but no, they can't. What can protect though, which we can see here, is the muscles that actually can help with strengthening and stabilizing the whole vertebra. These little muscles, I'm not sure if you can see that, I'm trying to bring it a little more closer. So these little muscles right here, we call them multifidi muscles. These are the small muscles throughout the whole spine and they go one vertebrae by one vertebrae instead of going like these guys from top to bottom. They go vertebra by vertebra and they localize the strengthening of the muscle. They locally can protect the bones so they don't get rub against each other. As you can see, the contraction of these are very useful, but contraction of these are not that useful because they just pull randomly and blindly on the bones, and they can even harm them and make them more sublux and out of place. But these are stabilizing, one level by one level. These are deep muscles. Most of us are not aware of these little muscles, and we don't really strengthen them. And what we do, we try to tighten up and strengthen this muscle, and what body does, because they are bigger muscles, they try to take over when we get whiplash and we get ligament injury. So I want to show you one exercise that we can strengthen the deep muscles, the multifidi, versus these guys, okay? Because as I showed you, the big muscles, we need to massage them after a whiplash because they get tight. What we need to strengthen are the deep muscles. We're gonna need a pillow for that exercise. I'm gonna go ahead and take that pillow back there. So what I want you to do, I want you to put the pillow on the wall and push your head against that pillow while you have a good posture of chin tuck, okay? I'm gonna take the pillow back towards the wall, okay? What I'm gonna do, I'm pushing my head against the pillow. 1, 2, 3, 4, 5. We call them isometric exercises. Nothing moves really vigorously. It goes really pushing, pushing, pushing without moving anything. 1, 2, 3, 4, 5. And then backwards. 1, 2, 3, 4, 5. I'm pushing, as you can see. I'm pushing my head against the wall. And then this way also. 1, 2, 3, 4, 5. We can even put this right here and push forward. 3, 4, 5 against it. So what we need is very simple. We need just one pillow, and we push our head towards the pillow while we holding and we counting 1, 2, 3, 4, 5. Very easy, right? So now this exercise is one of the most important but very simple. Looks a little funny, but that's the most important exercise that can stabilize and strengthen your neck. As we said, is all not about the superficial muscles. We try to relax and loosen up the superficial muscles in the last session with a lot of stretching. We try to strengthen the shoulder blade and work on the posture. And what's missing is we need to really strengthen the structure, the fundamental area. It's like a foundation of the building, the spine. The spinal column needs to be stable, like a foundation of a building, for us to be able to freely move without pain or injury to the nerves. So for getting the structure firm, we can use the pillow and do the exercises. I hope you enjoyed the video and you could learn something for strengthening the core muscle of the neck. If you have any comments, please comment me underneath the video. If you want to follow me, you're welcome to follow me on Facebook, YouTube, and Instagram. Thank you for watching. Stay safe and have a great day.